I'm delighted to talk to you because the world is looking for some good news right now. And as an 87-year-old man, you are in the high risk category. And I don't know that I've seen a story of someone your age surviving. If it has happened, I just haven't seen it. So I'm eager to let you start. How are you feeling?
Well, I'm feeling great, and I was very fortunate to find myself land here at the Mayaguez Medical Center. As you may know, I was evacuated from a ship. We were on a cruise in the Caribbean, and I was feeling pretty lousy about 6 days into a 14-day cruise. So I kind of let it go, and it got getting worse and worse, and I had trouble breathing, and I couldn't walk very far. So I finally, on the third day, my wife convinced me to go down to the medical center. I checked in there, and they saw that I was in pretty bad shape. They did all the tests they could do. They didn't have any of the virus tests, but they did have the x-rays and the blood tests. And I happened to glance at the x-ray that they took of my chest, and both lungs were just practically black, filled with infection. So the doctor on the ship immediately started treating that with antibiotics, and he consulted with the ship's captain, and they decided that they would evacuate me.
So the United States Coast Guard, and I should let everyone know you are a retired U.S. Marine.
I am, 25 years.
The United States Coast Guard came to your rescue. And so
they did.
Before I ask you about the evacuation process, I just want to understand, you had shortness of breath. Did you have coughing and fever as well?
I had no fever, but I did cough a lot.
Okay, you had coughing. Okay,
Yes.
So at the time you were on the ship, did they at any point say, well, maybe we ought to test you for COVID-19? Was that even a conversation on the ship?
Well, they didn't have any test kits to begin with.
Right. But was
So
there a suspicion?
well, I don't think the subject came up. It really
Okay.
didn't.
Okay.
The doctor saw what I had, which was infected lungs, and he treated what he saw there. And then they allowed that this might be bigger than we can handle, so we should get with the Coast Guard and evacuate him.
So the Coast Guard flies in to evacuate you. Tell me about that process.
Okay, well, they lower a basket down to the ship's deck, and they carry me out, and they attach the basket to a cable that they lowered, and pull me up and into the helicopter, and then flew me here to the Mayaguez Medical Center.
So you get there and have your conditions by that time. If you can just straighten the camera just a little bit toward the middle to where you, yeah, perfect. Thank you, Mr. Eller. So you get to the Mayaguez Medical Center.
Yeah.
Had your conditions worsened by then? Were they the same?
No, it was the same. It was pretty bad, actually. Yeah.
Yes, sir. So
Coughing.
Go ahead.
Got a lot of coughing and no pain as such, but very uncomfortable.
So when was the first time someone said to you the word COVID-19 or coronavirus?
It was right there, shortly after I got into the Mayaguez, and fortunately they had a test kit there, and they did the test and sent it away, and I don't recall just how many days. I think it took about 6 days to get back.
Wow.
But it did come back positive. In the meantime, they unleashed full efforts to treat me with antibiotics and give me oxygen and get me stabilized. And once they got the test results, then they knew what they had. But even before that, suspicious that it might be the virus, they put me in isolation. So I was put in a room with no other people allowed in unless they completely dress out and come in with the mask, the gloves, the whole outfit.
What kind of treatment did you receive?
Well, the primary treatment is the antibiotics to fight the infection in the lungs, and then the oxygen to help me breathe better. And there were other drips they put in. I don't recall just what they were, but whatever they did, it stabilized my condition, and it has gradually improved to the point that I can breathe on my own now.
Were you ever on a ventilator?
You know, I'm not sure I know what a ventilator is. I'm on
So,
a oxygen mask,
okay,
and they
okay.
feed oxygen to me, but I really don't know what a ventilator is.
Ventilator would mean where they would intubate you and basically sedate you to where you would not be conscious, but you've been conscious the whole time, right?
Oh yeah, absolutely.
Okay, all right. So it doesn't appear that you were on a ventilator. At what point in the treatment progress did you start to feel relief?
Uh, well, I would say once they got me in this isolation room and started getting the antibiotics in me and the oxygen, almost immediately.
Almost immediately.
Almost immediately, yeah.
You're by yourself. The Coast Guard evacuated you, not your wife. So did she continue on
She
home?
did, and she continued on for 4 more days
Oh boy.
and offloaded with the ship's passengers in Miami and flew back to our home in San Diego.
Okay. All right.
And of course,
So
they're all nervous back there,
yeah.
wanting
Yeah.
to know what's going on. And
Do you have
she lives, my daughter lives with us there,
okay.
and both of them have been tested since she was in close contact with me, and
Yeah.
my daughter has now been in close contact with her. But they haven't gotten the results back yet.
Oh, okay. How long have they been waiting, your wife and your daughter?
About 6 days.
Okay. All right. It may be hard to answer this question, but do you know where has anybody told you where you may have come in contact with the
No,
virus?
I wish I knew the answer to that. I mean,
Right.
we flew out from San Diego and we intermingled with people in the terminal in Miami.
Yeah.
And then you're intermingling with people all the time on the ship.
Sure.
And who knows where I contact. All I know is that it was about 6 days after I got on the ship that I began to go downhill.
And I assume you had gone into all of the common areas and that kind of
Oh,
stuff,
yes,
right?
absolutely.
And when you presented with symptoms on the ship, did they come on in the morning, at night? When did it start? What were you doing when you first said, I don't feel well?
Well, like I said, I let it go on for 2.5 days before I went there.
Right.
And
But do you
then
remember the first symptom?
the first symptom. No, it probably would have been shortness of breath.
Yeah.
And my wife remembers, but I don't, that several times during that 3-day period that I was getting sicker and sicker, that I couldn't breathe laying down. So I had to sit up in bed or go sit in a chair. And that happened on the first night. So yeah, I'd say the first day.
Do
I
you have
started.
any underlying health conditions?
I do, and I guess that makes this recovery that much more special because
Astounding.
I have emphysema in one lung.
Wow.
I have a heart disease. I have a leaky heart valve. I have peripheral neuropathy, and I have a irregular heartbeat.
Oh, Mr. Eller.
Oh,
I mean, you have 5 big old check marks and you're a survivor. Wow.
Exactly. Yeah, I feel very fortunate.
Wow. Tell me about the care that you received at the hospital.
It's just been outstanding. I mean, and they give it in a caring, they care, they really care.
Had you met anyone who was Puerto Rican prior to this experience, sir?
Oh, in the Marine Corps, we have a lot of Marines, Puerto Rican, and they're great Marines, but I haven't spent a lot of time one-on-one with anyone.
I
But they're
ask you that only
very
because they're very
cheerful,
what?
happy,
Yeah, yeah,
and
yeah.
and not just the nurses that are taking care of me, but everybody. The window's wide open here. Anybody can walk by. They're
Yeah.
walking by and giving me a thumbs up. And it's very heartwarming,
It makes you emotional.
almost,
Why?
to think that they don't know me personally,
Yeah.
but they
I
have
a-
that human something or other that says, this guy's got a problem, let's reach out to him.
I ask you, Mr. Eller, if you had met anyone who was Puerto Rican because I had never met anyone who was Puerto Rican until 2017 when I was sent there by CBS News to cover a hurricane. And over the last several years, I've made issues related to Puerto Rico something that I've spent a lot of time covering.
Yeah,
And they are some of the most joyful, kind people who want to give you everything they have
yeah,
to see you smile as much as they smile.
I agree. And I don't know whether it's just that's the case here in the hospital or whether that's
It's
all
all
of
over.
Puerto Rico.
It's all
Well,
over.
that's
Yeah.
a wonderful thing for them
Yeah.
to have.
Yeah. My hope is that you one day get to come back with your wife and just experience a little bit of the island.
Well, we've been to San Juan. We've been
Okay. Okay.
several cruises, and we all
Okay.
usually stop in San Juan, but
Yeah.
just for a day.
Yeah.
That would be nice. Yeah.
That would be nice. That would be nice. What's the prognosis for you?
The prognosis is I'm ready to go home this Sunday.
Is your wife coming to get you, or are you flying home as an
No,
unaccompanied adult?
fortunately we got medical cruise insurance coverage,
Oh, yeah.
and that company has arranged the flight. They'll pick me up here at the medical center, take me to the airport, accompany me back to San Diego and to home.
Will you fly on a commercial, or is this a private flight?
It's a commercial plane.
Wow. Okay.
Yeah.
So
So in other words, when they release me, I'm out of quarantine.
yes, sir. Yes, sir.
I'm not one of those, I think, that people have to be wary of and avoid.
So you entered the hospital when? Like, how long have you been in the hospital?
It'll be 2 weeks this coming Sunday.
Okay, got it. So yeah, your 2 week mark. And
Right.
my understanding is you've had a second COVID-19 test and you tested negative for that one.
Yes, and a third as well.
And a third tested negative too.
Yes.
Okay. All right.
That's one of the criteria they have for releasing someone, is that they test negative 2 times
I see.
after they've tested positive.
I see. Is there anything I didn't ask you that you'd like to add?
Well, I would just like to say one thing.
Okay.
I really owe my recovery to 4 things.
Okay.
I kind of rehearse this. First of all, the Marine Corps trains its Marines to deal with adversity.
Yeah.
They teach us to adapt, overcome, and continue the mission. And that's what I've tried to do every time I've encountered an adverse condition in my life. And with 2 tours in Vietnam, plus other national emergencies that Marines responded to, I feel that I can speak on the subject of adversity.
Yeah.
The second one is my wife and family back in San Diego and Humboldt County, California, for their love and support. Of course, we could not have done it without the hospital's outstanding efforts. And finally, the grace of God.
Amen.
That's why I'm here.
Amen. Why don't you tell us your wife's name? If we're going to give anybody a shout out, we ought to give your wife and daughter a shout out.
Well, my wife's name is Dee,
Dee.
D-E-E,
Okay.
and my daughter's name is Cynthia.
Cynthia. Okay.
Who we call Cindy.
Cindy. Well, I'm going to ask the hospital to send me a couple of pictures of your daughter and Cindy, and maybe some of you guys on the cruise ship that I can use in this story so that people can see you in happier times without a mask, smiling.
That would be great.
Yeah.
Okay. That's
fine. Listen, I want to first thank you for your service.
Thank you,
second, thank you for sharing your story, because we are all living with this new normal, and we're all, according to the experts, vulnerable. And, to hear a story of recovery from a man your age, 87 years old, who has the 5 underlying health conditions that you listed is astounding, that you will walk out of the hospital. So I'm eager to share this story with everyone.
Well, thank you, David.
Yes, sir. Yes, sir. I wish you all the best.
Thank you very much. You as
all
well.
Right. Thank you, Mr. Eller.
Bye.
Medical Center. This patient was sent to us through the Coast Guard last Monday, March 9th, and we received this patient here having all the medical measures necessary, and he was transferred immediately to an isolation room where he spent all his days while we were figuring out how severe his condition was going to evolve. I have to say that on day 1 that we received that call from the cruise and the medical doctor from the cruise, we got all the medical information from them, including a chest x-ray, all the labs, and certain lab tests that were necessary to make sure what we were dealing with. So in the cruise, he had the influenza test, the mycoplasma test, which are the most important infectious labs right now, just to rule out any other possible condition. So we had all those tests when he arrived here. So I have to say that I saw his chest x-ray from the cruise, and from that moment, I knew we were not dealing with a common pneumonia process from the x-ray. So that's why we treated this patient from day 1 as a possible COVID-19 patient.
What was different, doctor, if I may? I'm trying to use this opportunity to inform other doctors who are treating for the first time too. I mean, it's kind of a treat as they go. What was different about that x-ray?
Well, when a patient has pneumonia, the findings on x-rays are called infiltrates. So his infiltrates on the chest x-ray were more central and what we call perihilar. So that's not unusual pneumonia. Pneumonias usually affect a certain part of the lungs, either the upper zone or the lower zone. So his infiltrates were concentrated on the central part of the lungs, which is not common in a pneumonic process. So at that moment, we knew he had high suspicion, plus his white blood cells were overall elevated. However, he did have lymphopenia, which is found in these type of patients. So that's why on day 1, since he arrived here, he was our first, and he was treated always as a suspected COVID-19 case. So we took all the measures, we transferred him to the medical ICU in isolation with negative pressures, and our staff was always protected just to make sure they were safe from day one. So we took these patients to the medical ICU just to make sure we had a close monitoring of his respiratory condition, because as you know, this patient had a prior history of chronic obstructive pulmonary disease, heart disease, cardiac arrhythmia. So he had all the possible comorbidities to get very complicated, especially respiratory. So the first 48 hours were the most important, and he evolved very favorable. I mean, he never developed distress. Initially, he was having increased work of breathing, but he never needed to be intubated or placed on mechanical ventilation support. Actually, he was receiving 50% oxygen concentration through a simple mask. So we treated him with IV fluids. We were monitoring always his temperature, his vital signs. At the beginning, his cardiac arrhythmia was the most important thing that we were looking at, because he was unstable from that point of view. But in the first 48 hours, he responded very well to the medical treatment given for his cardiac arrhythmia.
Were you surprised at how well he seemed to improve, at how much he seemed to improve so quickly?
Yes, we were surprised. I mean, he had all the demographics, to say that, or the characteristics that have been published for a patient to get complicated, and sadly for the patients that are dying with the virus. However, these are the moments where you realize and you confirm that this is a multifactorial thing. I mean, it all depends. Not everybody is going to die with the virus, okay? So
right.
There are a lot of confounding factors that are playing here. I mean, this patient was 87 years old. He had a chronic respiratory condition, a chronic heart disease, and he was not complicated. So this brings optimism for us and for everybody, that not everybody is going to die with the virus, and there are some things that can be done. So I think for us, this is a way of saying that we are blessed under the epidemic or the pandemic that everybody is confronting right now around the world.
I hear you. My last question is there any other advice or guidance you would want to share with other doctors based on your experience treating this patient?
Well, I can say, and I can follow the words of Dr. Ramirez Ronda, that the most important thing that we need from everybody is just to people remain with social distancing, to avoid places with a lot of people, just stay at home and help us help the situation. Because and the other important thing is that I have to say, and is that I have to admit that we've had all the backup from the administration in the hospital, and all the measures have been in place since day one. Everything that we needed to establish the protocols, we worked those protocols very fast, and that's the most important thing, to have your hospital organized in a way that things run the way they're supposed to. So everybody has to sit with their hospitals and make sure that you're making all the measures, and that you have all the staff protected, and all the things you need to keep up with the situation. I mean, the materials, the protocols, all that has to be very well organized. Don't wait for your case to come to your hospital to improvise. I mean, you have to do what you have to do ahead of time.
That is so important.
That's the most important thing.
That's so important. Just yesterday, I spoke with 2 funeral homes who had no guidance on how to handle a suspected COVID case, and it was a complete debacle and chaos for them yesterday. And that's a story I reported on. So to hear you sort of make it clear that you got to establish a protocol before you get your first patient is really good advice. Doctor, I thank you, and
Thank you.
I congratulate everyone at the Mayaguez Medical Center for having a case that turned out quite like this. I mean, it's really astounding. I keep using that word, but I mean, everything I'm hearing from you and hearing from him, he would have been a classic case of someone who would have been at great risk of dying, and he didn't.
Of course. Yeah.
Thank you, doctor.
Thank you.